Welcome to the Limitless Ladies Network, a women's holistic wellness podcast where our mission is to help women build holistic self-care. The following disclaimer applies to all episodes and content shared on this show. The views and opinions expressed on this podcast are those of the host and guests and do not necessarily reflect the views of Limitless Ladies Network or its affiliates. The information and advice provided on this podcast are for general educational purposes only and should not be considered as professional medical, nutritional, or therapeutic advice. The content shared on this podcast is not intended to diagnose, treat, cure, or prevent any disease or health condition. Listeners are advised to consult with a qualified healthcare professional before making any changes to their diet, lifestyle, or health routine. By listening to this podcast, you acknowledge that you are aware of the limitations and potential risks associated with the information and advice shared on this show. You release and hold harmless Limitless Ladies Network, its hosts, guests, and affiliates from any liability for any damages, losses, or injuries that may result from the use of the information and advice provided on this podcast. Welcome to today's episode with Natalie Walters of the New London Natural Health Center. Today's segment, we're speaking with Natalie, who is a board-certified adult nurse practitioner with over 30 years of experience helping people to optimize their health and well-being. Natalie specializes in functional and integrative medicine, which is personalized, preventative, and seeks to find the underlying causes of illness. Natalie's approach is food first and lifestyle first. That is awesome. She also uses herbs, supplements, and peptides, and at times pharmaceuticals. So welcome, Natalie. It's a pleasure to have you on our show today to talk about osteoporosis.
Yeah. Would
So
you like me to start? Oh, okay.
so tell us a little bit about how osteoporosis actually affects men and women. Is it equal?
It's not equal. Women, it's about 1 in 2, so 50% of women, which is a lot.
That
It's
is
a
awesome.
big number. It's a big number. Men, it's about 1 in 4, so about 25%, but still a big number.
Yeah.
Still a big number, yeah. And unfortunately, men don't get routinely screened for osteoporosis. Where women do, but yeah, it's not something that happens often for men. So yeah, it's definitely something that men should have on their radar,
Yeah,
especially as they age.
that is
Yeah.
definitely a good tip to have for guys because you would think that their general primary care physician would want to do a test like that.
Yeah, it's typically not done. Even women, women, it's typically done at age 65 for women, but women have been without estrogen by the time they're 65 for at least 15 years. So, it's really, I counsel people, to have it done sooner, at least by age 50. And that's if they don't have other risk factors. But yeah, insurance, sometimes won't pay for it if there aren't specific risk factors. But, being menopausal is a risk factor.
Right.
So yeah, so it depends. Yeah, it depends how the healthcare provider is coding and documenting, to get it covered by insurance. But
Right.
yeah,
So
yes,
how early
yeah,
can that happen? Because some people, like myself, for example, like I was kind of menopausal, like a full-blown menopause, probably at the age of 46 or 7. So
yeah, yeah. And some women are. Yeah, I mean, if it were me, I would insist on a bone density on a DEXA scan, Yeah, absolutely. At least by the age of 50. But if you go through menopause early, I would ask for one then, and at least every 5 years, depending on what the previous results were, what your other risk factors are. Um, it's something we don't think about our bones. I mean, do you ever think about your bones? I don't, unless we break one. you know so I think we just think they're these hard structures, and they are, but they're constantly in flux. They're constantly being built and broken down and built and broken down, and then as we age and our hormones decline, there's more breakdown than there is buildup. So it's just something to be aware of, and it's something we have to take care of. We have to intentionally take care of our bones.
Yeah, and you don't really think that your bones deteriorate over time because whenever you see a bone somewhere, you always think that it's really hard. It's not
Yeah.
porous, right?
Yeah, that's a good point. Yeah, it's a good point. That's true. You can dig them up even, hundreds of years later. Yeah. Yeah, it's a really good point. But yeah, they definitely degrade even, while we're still alive, unfortunately. So yeah, it's something just to be really aware of, as we age, so that we can stay healthy.
Absolutely. So you mentioned a few things on risk factors to get tested earlier. What are some of the risk factors?
Sure. So any chronic steroid use would
Mhm.
be a risk factor. Any autoimmune disease, rheumatoid arthritis, Crohn's disease, ulcerative colitis, celiac disease, hypothyroidism, low body weight. So if you're somebody that's, has like a low BMI, that's a risk factor. Being female is a risk factor. And then medications, like steroids for sure. And here's a big one, and I don't think a lot of people know this. The GLP-1 agonists, Wegovy, Mounjaro, Ozempic, they break down bone.
Mm.
They break down bone. We know that I think a lot of people know that they contribute to muscle loss. They contribute to bone loss. So that's a big one too. Yeah.
Which makes total
Um,
sense because in order to build up your bone mass, you need to exercise and strength train,
yeah,
right? So if you don't do that, and
yeah.
if that particular drug is actually minimizing your muscle mass, then it makes sense.
It does. Yeah, absolutely. Yeah. But I don't think a lot of people and it seems like everybody is on that medication right now. And I don't think most people know that. So, yeah. And then there's some anti-seizure medications that will break down bone faster. There's some antidepressants, PPIs, which are things like Protonics and Prilosec. They will break down your bone. So yeah, so there's medications. Yeah, I'm probably missing some, but those are some of the big ones.
That's good to
Yeah,
know because now it seems like there's a lot of push on. I mean, I don't watch a lot of TV anymore because it's not useful to me,
yeah,
really.
yeah.
But it just seems like there's always, even on the radio or wherever you're listening and getting news from, that there's always these pushes for all of these medications, right? And then people
Oh
don't
yeah,
realize they hear all the long list of side effects of things, but you don't realize that osteoporosis or osteopenia maybe would be part of those side effects. Then you fall and you break a hip, and then that you're in trouble.
yeah. Absolutely, absolutely. Yeah, yeah. Unfortunately, yeah, it doesn't get explained to people. Yeah. So, yeah. So just so we get it out there, because yeah, the I just learned that recently about the GLP ones, and I was floored. I was driving in my car, and I wanted to scream and tell somebody, like, oh my goodness. Yeah, it's scary to me because muscle loss is bad enough. A little bit easier to get your muscle back than it is to get your bone back. It's
It is, but at the same time,
yeah,
muscle mass and muscle to get back it can be difficult too as we get,
absolutely,
which is why we also need to do those strength training segments at least a few times, 3 times a week, right? To really
absolutely.
resistance.
Yes,
You don't have to be with
yes,
weights, just resistance bands, body weight, anything.
yeah,
Which
yes,
when you get older, you don't generally think about doing those because we're not on the farm anymore, lifting buckets and doing heavy lifting as we used to years and years ago. So
yeah. So true. Yeah, I think we used to be much more physical in society, yeah, than we are now. So now we have to be intentional about it and set time aside for it and
absolutely.
yeah, all those things. Yes, definitely.
Squeeze it in there somehow, yeah. Yep.
Yeah.
Are there any roles that our hormones, we as women, I would imagine, have an impact too, with us being more at risk for osteoporosis, right? What are our hormones have to do with all of that?
Sure. So estrogen and testosterone both play a role. I mean, estrogen takes a bigger role. Um, when you have enough estrogen, you have a nice balance of the cells that break bone down and build them up. But then as our estrogen goes down, and this really even is for men as well, because as men's testosterone is declining, their estrogen is declining as well. So as estrogen goes down, that bone breakdown is happening at a higher rate than it has previously. And the bone rebuilding is happening at a lower rate. So it's, you're at high risk for your bones becoming more porous and then, developing osteopenia, which is, a precursor, so to speak, to osteoporosis, but you really don't want to have either.
Right.
Osteopenia is not good either. You want to try to prevent that just as much. I think of it as like pre-diabetes, and I think to myself, I don't know where that term came from because it's still a disease process.
Right.
Pre-diabetes is still a disease process. Osteopenia is still a disease process. I think sometimes, I don't know, it's played down, but it's a problem. It's definitely a problem. Yeah,
Osteopenia versus osteoporosis. So it sounds like osteopenia is the precursor to you getting full-blown osteoporosis.
correct. So if this is healthy bones and down here is osteoporosis, osteopenia is you sliding down the slope,
Okay.
you know? Yeah, so it is still disease process. It's not full disease, but it's definitely something we want to prevent. And if you have it, we want to reverse it.
So how do we do that?
Sure. Yeah. Yeah. So lifestyle wise, like you already said, I mean, resistance training of some kind is just non-negotiable. It's just non-negotiable for health, but it's definitely non-negotiable for us for preventing or even reversing osteopenia. So like you said, whether it's resistance bands, body weight, weights, yeah, something. Even jumping, jumping exercises have been shown to help rebuild bone.
Yep.
Um, so yeah, and there's those vibration plates. There's some evidence those can help. Wearing a weighted vest, there's some evidence. So yeah, some kind of resistance training. And then as far as what you're eating, you know, you want most of what you're eating to be one ingredient foods, you know, eh, whole food, one ingredient. Yeah. And then stress and sleep. Sleep
Organic
has to be,
foods.
yes, if possible. Yeah, if possible. Yes, absolutely. Yeah, and stress and sleep are so big. When we're stressed, we secrete more cortisol. And guess what cortisol does? It breaks bone down. It does a lot of things in the body, but it definitely contributes to bone breakdown. And same with sleep. I mean, if you're not sleeping, your whole body is stressed.
Yeah,
So yeah,
absolutely.
yeah. So those are lifestyle. And then, minimizing alcohol. Alcohol's a big one, not smoking. Those contribute as well. And then, not everybody is going to need hormone replacement to prevent osteopenia or osteoporosis, but a lot of people will. Um, and estrogen is actually FDA approved to prevent osteoporosis. It can reverse osteopenia. So that's something as well. If you're diagnosed with osteopenia and you really want to get on that and do something. If you're a woman, yeah, estrogen therapy. For men, testosterone can help prevent bone breakdown. Estrogen and testosterone, about 20 to 40% fracture risk reduction for men and women if it's replaced. Yeah, it's pretty big. It's pretty big. I mean, you know, I always promote lifestyle first, because medications or hormones aren't going to do everything. But as part of an overall plan, yes, they can be very helpful.
Absolutely. So when we talk about getting estrogen and testosterone, we then probably need to have those balanced, right? And then you got to throw in progesterone in there as well. Like, do you need to have kind of a cocktail of hormones, I guess? Or is it
Yeah.
truly just that you can get away with estrogen cream or, an estrogen patch?
So estrogen cream won't do anything for your bones. But an estrogen patch, yes. And if if you still have your uterus, so if you haven't had hysterectomy, you have to have progesterone with the estrogen. Progesterone and estrogen together, though, have such nice synergy that I usually recommend both of them anyway. Progesterone can be so good for insomnia and anxiety. It helps to protect our brain cells, and it does, help potentiate estrogen. So, um, yes, both of those together, if you don't have your uterus and you don't want progesterone, you can just use estrogen. And then for women, know that women can use testosterone.
Mhm.
And I think most women do best with all three. Most women do really well with all three hormones. And then men, testosterone, it's going to help them prevent many things, but bone loss is one of them for them. Yeah, it's good for their brains, just like it's good for our brains. There's so many good things about it as we age when we're losing those hormones. So yeah, but yeah, the balance is nice to have for women because women we're much more complex hormonally, than men are.
We're
So yeah,
complex in so many ways, but yes, throwing the hormones there, of course we
yes, yes, yeah, we've got a lot of this going on.
yes, we do.
So yeah, yes, yeah, to get that nice and settled and evened out can be a beautiful thing.
Definitely. Is there any way besides like the DEXA scan? So the DEXA scan is something you have to have scheduled that goes through your primary care or your OBGYN.
Typically it's primary care. I think some OBGYNs do order it, but I think typically it's primary care. Yeah.
Okay. But is there any way that we personally could do some type of an assessment of ourselves to be like, all right, do we have
Yeah.
bones?
Yeah, there's something called a FRAX calculator, FRAX.
Okay.
I think I have the website. I think it's fraxplus.org.
Okay.
And then it's slash calculation tool. But yeah, if you just put an like Google FRAX calculator, and it's going to ask you about smoking, it's going to ask you about your age and your weight. I think it asks about family history. It does ask for like a T score from a DEXA scan, but you don't have to have that to get a score
Okay.
from that. Yeah, so that can be a good way to, educate yourself, right, about the risk factors and get some kind of an idea where you fall. Um, and really that could be something that you could take to your PCP and say, if it's especially if it's high and say, I really need a DEXA scan. I really, yeah, I have to have this. So yeah, it can be a good tool for people,
Like a great
definitely.
self-assessment tool for anybody just to go out there and fill out and then see where you are. And then
Definitely.
next steps, go to your PCP and kind of take that and advocate for yourself and say, hey, I really do need this. So then you
Yeah.
officially get a documented, I guess, baseline for them to go off of, right?
Yes. Yes. Yeah, and it is a good idea, like I said, at least by 50, if not sooner, depending on your risk factors, depending on when you go through menopause, to have a baseline. And then, depending on what the results are and what your risk factors are, you would still want to do follow-up scans, at some point. The interval is going to be different depending on risk factors and the results. But yeah, I would say at least every 5 years, if they're normal, just to keep an eye. Yeah. And in the meantime, of course, work on doing everything because everything you're doing to keep your bones healthy is also keeping your heart healthy and your brain healthy and your muscles healthy. The answer to health usually comes down to those what you're eating, how you're moving, how you're sleeping, and how you're managing stress, right? Yeah. So it's kind of a win-win, at least in my eyes. Yeah,
Agreed. Agreed. So with the osteopenia side of things, because that's kind of the precursor, right?
yeah.
Are there any things, I mean, we talked about all the basic things. Are there any other like natural remedies besides taking hormone replacement therapy and doing those few lifestyle changes that someone would want to consider doing? Like I
Sure,
hear a
sure.
lot of, and I'm just going to throw this out there because, and maybe this is a misconception, right? I've heard like, just drink a lot of calcium and a lot of milk. And some people are not able to drink milk. Like I don't drink milk. I drink nut milk, so I don't drink dairy.
Hmm.
So I don't know if the calciums are exactly the same or equal to each other. Is calcium a big
Yeah,
factor that we should think about?
it is. It is. It is something for dietary or supplement. Calcium, but calcium doesn't work alone. So, you know, calcium, magnesium, vitamin D, vitamin K. Those would be the four basic things. And collagen is really good for your bones as well. Then, there's some other supplements that you can consider. Strontium is one, boron is one. Um, there are other like more advanced supplements, especially if you do have a diagnosis of osteopenia or osteoporosis, I think that you'd want to consider. But yeah, and you're right, a lot of people can't do dairy.
Right.
So a lot of people are supplementing. Yeah. And the reason, so vitamin D and magnesium help, they all work synergistically with calcium. Vitamin K is crucial though, because vitamin K will make sure that that calcium that you're taking doesn't get deposited in your arteries, but gets deposited into your bones instead.
Right.
We don't want calcifications in our arteries. We want them in our bones. So vitamin K's role, one of its roles is to help direct that.
That's,
So yeah, it is a mix of things. But yeah, and collagen or bone broth is beautiful
well,
for bones and
yeah.
the gut and your skin. Yeah. Yes. Yeah. So yeah, any type of collagen or just a collagen supplement if that's easier. But bone broth is really nice. Yeah. And we're getting into bone broth season. So
We definitely are. And I have my
yeah.
bones already in the freezer and I need to
Yeah.
make bone broth probably this week.
Yeah. Yeah, that's great. Yeah, so those are definitely some things to focus on. And vitamin D and magnesium is so good for so many other things, helps you stay relaxed, helps your neurological system work better. And vitamin D really is a hormone. We call it a vitamin, but it is a hormone and it's implicated in so many, if you don't have enough of it, so many disease processes. So
Mm.
it's a really important thing. So many people are deficient in vitamin D, especially those of us that live, in the northern
In
hemisphere.
Northeast. Yes. Yep.
Yeah, yeah.
And even more
So,
so now that a lot of us are stuck inside working, at home or even still in an office, it seems like there's just not a lot of people that even on the weekends are getting outside.
yeah,
You need some
yeah. And we need
sun.
sunlight.
Yeah.
Yeah. We need UV to convert vitamin D in our skin. Yeah, absolutely. Yeah. So that would be another thing, at least yearly have a vitamin D level. You know, ask your primary care provider to have a vitamin D level, definitely, as part of your routine labs, because we really like to see it 40 to 60, maybe even a little bit higher for some people, than 60. So yeah, I would keep an eye on that from at least yearly.
Do you think that a good supplement that's an all kind of multivitamin for women? I know there are some that are age specific, like 50, and I don't know if they have them higher because I'm around 50. So,
Yeah.
they have them specifically for those age groups. Do you think that those suffice? Like mine has a whole list of things, but I don't know.
Yeah, maybe. I mean, it would depend what's in it and how much is in it. Yeah, yeah. I mean, you really want to get like 1,500 milligrams of calcium, at least depending on your vitamin D level, anywhere from 2,000 international units up to, just depending. Magnesium, 2 to 400 milligrams a day. Sometimes, magnesium can loosen your bowels or cause GI
Right?
distress. So,
And how
so
much?
you kind of have to, yeah, sometimes you have to adjust the magnesium. Um, yeah, so it would depend, but yeah, I mean there are some good supplements out there. Typically, when there's a bunch of stuff stuffed into one capsule, it's usually lower concentration. There's only so much they can fit in. So yeah, it would depend, but there are bone specific supplements out there. One of the ones that I like is called Algae Cal Plus. ALGAE Cal Plus. Yeah, that has the strontium and the boron, and a few other things in it. But there are specific ones. So yeah, it depends, I think, whether you already have healthy bones and you're trying to maintain them, or if you already have some disease process going on and you're really trying to kick things up a notch, so to speak, and get things reversed. Yeah, definitely. But yeah, calcium, yeah,
Yeah. How long do you
really.
think that it would take if you start doing lifestyle changes and you're active and you eat healthy to kind of reverse osteopenia? Like, does it take
Yeah,
just to get back?
a year or two.
Okay.
Yeah, I mean it can take a little bit of time. Yeah, even with hormone replacement, it does take time, to build that bone density back up. Um, but yeah, the more you do, the more tools you use, the quicker it's going to be.
Right. It's a good ad for, holistic living, right?
I know, yeah. Yes.
Well, this was great,
Definitely.
Natalie. I really appreciate you sharing all of this information for us on osteoporosis and a bit on osteopenia and that wonderful tool that I'll have to check out as well on kind of self-assessment. I love that.
Yeah, me too.
Tell us where, besides on our directory, we can find you.
So I am transitioning. I'm with New London Natural Health Center right now, but starting the end of October, I'm transitioning to a solo practice. It's called Regen, hormonerx.com. The majority of what I do is hormone replacement. I'm really passionate about it. Changed my life. It's all a personal journey that led me here. So very passionate about it. So I'm looking forward to it and I'm happy to answer any questions for people. There's a form on the website. If people have questions, they can message me. And yeah, whatever I can do to help, prevent osteoporosis and osteopenia, I'm happy to do.
I love that. And congratulations on starting your own practice.
Thank you. Thanks. Yeah, I'm
Very
excited about it.
exciting. That is
Thanks.
exciting.
Yeah.
Excellent.
Yeah.
And of course, don't forget to check us out on Limitless Ladies Network. And Natalie is also there right now. We'll have to update our directory too to get her latest information. But definitely check that out. And we also have some self-care socials that we're doing weekly at our local senior center and a ladies' night out, actually, which you should come to. And that's going to be September 17th. That's for anyone to come to, really. No.
Wow. Sounds nice.
Yeah.
Yeah.
Hopefully it's good weather, although
Great.
it doesn't matter. It'll be outside with a beautiful view of the lake. So
Oh, that sounds lovely.
yeah, so come join us.
Okay, I'll take a look at it, definitely.
Sounds good.